So one of the exercises that we like a lot in physical therapy for patients with knee pain or lower extremity weakness is something that we call the step TKE, and that involves having the patient stand on a step with both feet initially. The higher the step, the harder this exercise is, so it can be initiated with a lower step, maybe a 2 or 4 inch step, working up to a higher step. The patient will keep the affected leg on the step. So if the patient is being treated for their right knee, they would keep their right foot on the step and they would take the left foot off the front of the step as if they were going to step down onto the floor. In that motion, the patient will keep the toes pulled up toward their nose. That's called dorsiflexion. So the muscle needs to work a little bit longer before they reach the ground instead of pointing their toes forward. And they'll come down, they will touch the ground lightly with their heel. I like to say that this is an egg toucher exercise. They're coming down and they're touching the floor as if there was an egg on the floor. They don't want to break it, they just want to touch it. So it's a very light tap, and then coming back up, pushing through the right leg and straightening the knee all the way. So that motion can be performed again with repetitions. Anywhere between 10 and 30, we usually do 20 repetitions. The key with this one and things to think about are a couple things. Number one, the knee needs to extend completely when they come back up, so making sure it comes all the way straight. Number two, making sure the foot that's coming down to the floor is coming down with the heel first and not the toe. The third thing to look for is to make sure that the touch on the ground is nice and light. It's not a hard step. And the fourth thing to look for is to make sure that the motion is coming from the legs and not from trying to twist the hips to reach for the floor at all. This shouldn't be done if it causes any pain, but as long as it's tolerable and not causing pain, it's good for patients with general patellar pain or pain around their kneecap, patellofemoral pain syndrome, sometimes IT band syndrome, general lower extremity pain. Even some patients with ankle pain can benefit from this exercise. If the patient wants to perform this at home and doesn't have a 2 or 4 inch step to use, it can be done on a standard step, which is closer to 5 to 7 inches. We usually just say don't go all the way to the ground, go as low as they can go before coming back up again, working up to eventually getting to the ground. It's also important to make sure you're holding on to a wall or table or something nearby to help with balance and prevent the risk of falls.